Thank you very much for the intro. I mean, and thank you for being here today. I mean, I'm super excited. I think it's an amazing topic to talk about technology and how it affects our health and the amazing chance that we are going to have in the coming years. We have a very top panel. We have Antonio at the very end. He works for AstraZeneca. He's a CIO. Before that, he worked on Telefonica and also in IKEA, so he has an amazing profile, engineer and responsible of innovation on AstraZeneca to use technology to impact in a positive way the health of the patients, of the people, of the users of AstraZeneca. Then we have Jesus here. He said to me yesterday that he has the best job at Sanitas ever. He has been responsible of technology and innovation for 30 years there. I mean, Sanitas is very well known here in Spain for being an insurance company that innovates a lot. And now they are doing some amazing projects that he's going to share today. And then I have Eduardo. He's a doctor, but also an entrepreneur. And he built a fantastic software that makes hospitals much more productive and help patients on the, I mean, they orchestrate how hospital works, right? And help the pathway of the patients. And me, I'm Enrique Linares. I have been a founder for the last 15 years. I built Letgo, which was the first unicorn based here in Spain. I am board member of Faes Pharma. It's a pharma company here in Spain, a public company, big company. And I'm also part of Plus Partners, is where we invest. I mean, we're pending to be approved by the Spanish government, but we will invest on health here in Spain, on health startups. And with that, I'm going to start with the first questions for Antonio. And it's an easy one. Is as a pharma company, how can you help the patients to have a better health, right?
Okay, well, thank you for the question. It's an easy one to question, but maybe not so easy to answer. So, well, thank you, Enrique. Very, very happy to be here sharing some thoughts with all of you and with my fellow panelists. Very happy. So, yep, in AstraZeneca, our mission is that of providing or helping to provide a better life for all of the patients, and also to transform the health system for the better. And we think that with the best medicines, that is not enough anymore. So we need to not only to have the best medicines in the market, but also to have the ways that those medicines have a better impact in their patients and the management of their condition. So in order to do that, we take benefit of the unique position that AstraZeneca is in. You see that AstraZeneca is, let's say, in the intersection between the healthcare system and the healthcare providers and the patients' associations, and also in very close contact with the startup system and the technological partners. So when we look for a solution, we start with the patient needs. Always start with the patient, maybe with the patient journey. And Eduardo, I think, is going to be talking about the patient journey a lot, because that is key. Let's look into the patient journey. Let's see what are the bottlenecks. Let's see how we're diagnosing. Let's see how we're treating. Let's see how the patient is managing their health. And when we detect any opportunity to make that better, well, we make use of that ecosystem that we've built and that we're part, and look for a solution. If there is not a solution in the ecosystem, well, we help to make one. Once we have one, well, we test it out, and if we see that it makes sense, we double down with a solution. And then we iterate quickly. So, yeah, we have as a mission to transform the healthcare system and make the patient's life better through technology also, not only with science, but also with technology.
But that means that you as a pharma company don't only build drugs, but also you care on how patients perceive the drugs, the illness of those patients, how to treat them, and how to make them more healthy, right?
Absolutely.
That's the place where you're involved right now.
Absolutely. That is a great summary. I mean, we not only build drugs, but in our mission is that those drugs have the better impact in their patients' lives.
Super, thank you. And then we have, I mean, that's one side, right? And then we have insurance companies. Now insurance companies, they do every kind of things on health, but I would love to hear your thoughts on how technology is impacting. No? I know that at Sanitas you care a lot about prevention.
Yeah.
You built an app recently that is an amazing success. Almost 30,000 people use it today to have a better health and better life.
Yeah.
And if you can share with us how that works and your thoughts on prevention, that would be amazing.
Well, basically, I think that the first thing to say probably is that technology has always, I mean, Sanitas has been a very technology-oriented company, even though we work in health, but we have always used technology in order to make an impact on people's lives, like the ones you're mentioning. In the last few years, we are happy I think that we have put digital health to the best use with customers. So within our own app, we do have all sorts of different integrated solutions. This is important, integrated. They are not games to play, but rather integrated pathways using technology in order to guide patients through their health. Maybe I can put one example that you were just referring to when we were preparing the session, which is Salud Conectada, which, by the way, the father of Salud Conectada is sitting in the first row, so my recognition for him. This is our own platform, and it's developed by us, and basically it connects the three parts of a triangle made by doctors, patients, and wearables and devices. Let's put it that way. I know that there is a lot of interest around the world around what the wearables might imply for prevention and for people's health and so on. In our case, we already have nearly 30,000 people connected to the platform, which is a lot, to be honest.
How long did it take to 30,000?
Couple of years.
That's fast.
Yeah, it's fast, but even me, I'm amazed by the sheer amount of information we're gathering. I wasn't expecting to have as much information as we're gathering. And I think this paves the way for once being able to impact people exactly in the moment and in the shape that they really need to be impacted in order to promote healthy lifestyles and really unleash prevention, like really personalized prevention based on your habits and not in general terms. That's one. And the second one, which is also important, is because of the amount of data we are gathering, I'm sure that there is a lot of new science to be discovered within those data. So it's very important to be able to connect those data also with, the standard EMR data and some other sources of data, because I think one of the challenges, and I think he's going to be talking about this too, is how do we integrate the different stages within healthcare, which is being primary care, hospital, virtual care, this kind of thing. I think the sector as is now is like pretty isolated in each one of these stages, and there needs to be connection, and I think that is going to be achieved by the use of technology and data.
Super, super. And Eduardo, everybody wants to hear you.
Yeah,
right?
I know.
They refer to you.
No pressure.
So Uphill, you founded a few years ago, doing extremely well. Almost all hospitals in Portugal use his software. That's super hard when you care about private hospital, public hospital. I mean, that you are the player, the software provider. That's amazing. And now you started internationalization, right? And starting here also in Spain. Can you explain us what we can expect as patients, right? Like we go to a hospital, we know how it works, right? What does software do to improve the life of us as patients, right? How?
That's a good way to put it. So right now you go to a hospital to see a doctor, right? And the knowledge about all your condition, what's supposed to be done, the frequency of appointments you need to take, the therapies you need to take, the exams you need to do, they're all stored in the head of that physician, right? And that is completely unscalable for what we're facing as a healthcare system. We cannot tackle an exponential problem with a linear solution, with more and more doctors or nurses. And what Uphill does is we take that knowledge and we structure that knowledge as a clinical pathway that goes from the early prevention and suspicious of disease until the last resort treatment you would ever get if you went to the ICU because of a condition. Then we connect with the electronic health record systems of the hospital, and it takes a lot of work, it's true, but it's feasible. And we generate automatically these clinical pathways where patients are positioned. So it works essentially as the GPS and autopilot of a patient in a hospital. So we can track the patient across this journey. Even without physicians noticing it, things are occurring automatically within the hospital. Exam prescriptions are being done, suggestions are being done in terms of appointments, and automate a lot of the care plan for that patient. And what this does in practice is it increases the capacity of that hospital to follow more patients based on the best practices. And this is the only way we can actually have a healthcare system that's sustainable and that's deeply integrated from the initial moment you pick up an app and you search on a symptom checker and you're prompt with a possible diagnosis until the 10th hospital you'll see because of that condition. So that's what we're executing across Europe, and it's the only way to have sustainable healthcare systems, in our opinion.
Yeah. Does that mean that they will know everything about us or history, and everybody in the hospital will know that somehow, and we as patients also will know it? I mean, how, like in the last position of a patient, what is going to be the change for us, right?
Yeah, sure. So I think there have been a lot of movements in Europe specifically with European Health Data Space Regulation, GDPR, and data portability, a movement towards patients holding that information and that data and making it available where they go. I think as a company, we've been cautious about it. We are ISO 27001, so we have all the compliance. We're a medical device. And so we need to, in terms of go-to-market, we need to balance that with the future vision for the healthcare system, which is cross-border care. You would go to a different country to be transplanted if needed, and all your data comes with you, and all your care plan is shared with that new country or new hospital. So, but I think that in terms of execution, and as it encompasses multiple complexities, we need to take one step at a time. And so the first step is, of course, orchestrating care inside the hospital. The second step is orchestrating care with hospital primary care centers, tertiary centers, and then different groups, different healthcare systems is the last step, if you will. But in the end, all of it is going to be integrated, even with third parties, with digital applications, digital therapeutics. All of that is going to be within the same care journey, uninterrupted for you as patients.
I think if I may jump in here, I think this is very important. I think as a sector we have to recognize that we leave people left to their own devices. I was talking about devices before, but not the same devices. But we leave people with their own devices, so they are supposed to navigate a very complex system in order to take the best decisions for their health, and you are supposed as a patient to do that with knowledge. So I think it's most important that as a sector, we really organize the sector so we're able to steer and guide patients towards the most appropriate next action. I think that's something that we need to build all together also, because it is so scattered. So I think what you're saying is very relevant.
And I think that if I may, it's needed for the healthcare system for us to match the complexity of the patient to the differentiation of that service. So that's the only way to have reasonable economic resource usage. And even for pharma companies, for example, pharma companies right now, they have great drugs that can cure diseases. They're, for example, the third line of therapy. But there are numerous blockers for that patient to have that therapy because GPs aren't knowledgeable enough about the therapy or not allowed to prescribe that therapy, because referral can be delayed, because initial appointments can be stalled in the hospital, hospitalization can be very complex. And so if we know the knowledge of the ideal care plan for a patient, we can streamline all these processes and increase access to care. So essentially that's the mission.
Super. And there is something that may be a surprise, because we have been talking for 50 minutes and we didn't mention AI, right? That is the topic, right?
Let's try not to mention.
And especially for health, right? It's one of the areas where, for example, Microsoft is investing more, right? To use AI to benefit people's health, which is fantastic, no? Because we all want to live more years and be more healthier. And in that sense, it would be fantastic, Antonio, to hear from you. What is your perception of the use of AI in the sector, right, from a pharma perspective, because it has pros and cons, right? So how do you deal with that in the projects where you are involved?
Yeah, absolutely. Impressive, 15 minutes. No, AI. I do believe that AI is a revolution, and AI is changing everything. AI is changing each one of us because we're using AI tools. We didn't notice before, but we are noticing right now, and we're actively going and using those new tools. It's changing every industry, it's changing the society, and it's changing how we manage health. Absolutely, absolutely. And it is changing how we manage health at an accelerated rate. It's an absolute exponential. But then, yeah, there are shortcomings and there are fears on, well, beware of this AI, this Terminator that might not have the same intention that as a humankind. And it is a fair reflection, I mean, to think about how this is evolving and whether it will be exponentially beneficial for us in the future. Okay, it's a fair reflection. However, in the short term, middle term, we have to take into account that these new AI-powered tools, these new deep learning models that are helping us to maybe predict what is going to be happening with the patient, because we're detecting a variety of biomarkers that, according to the model, maybe is telling us that there will be some crisis in the future for this patient. So, having said and having agreed that there is a lot of value in these tools, in these models, how do we use them? And most important of all, how do we feed these new models? How do we train the models? And then how do we input those biomarkers in real time so we can have the results? And here, there are two things from a point of view that we have to think about. First is have very, very clear that that data is, belongs to the patient. Data belongs to the patient and no one else. And you've done a lot of things around that, and that is great. And second, we have to have zero trust. Zero trust, okay? We cannot be confident and comfortable when feeding training data to models, and also we cannot be comfortable using those outcomes, those insights. Why? Because it might have some kind of bias, and we have to take that into account as humans in the loop, okay? But then, how do we balance that? Data is the patient's, and also we have to have zero trust. How do we balance that with saving lives? Because using those models is already saving lives, and when we use more models like those, trained adequately, we will be saving millions of lives. So, well, great dilemma.
Wow. Yeah, we, during the last 6 months, 1 year, it's very common that people tell you, no, you know what? The way we're going to go to the doctor in 3 years, in 5 years from now, is going to be completely different to what it is today, because technology is evolving so fast. As they said, we have access to so much data that the way they are going to predict things and the way they are going to treat illnesses is going to be completely different, right? So the next question for you, Jesus, 30 years on innovation in health, what can we expect in 5 years? What is going to blow our mind, right? What is going to surprise us as biggest trends there?
It's a good question. I think things are certainly changing. I think artificial intelligence is not coming. It's already here.
No,
so
it happens.
already here. Still, there is a society that needs to adapt to the changes. So although I do believe that things are going to be changing fast in the coming 5 or 10 years, 5 years' time is a very brief period of time. I can tell you I'm old enough to say 5 times is nothing. And I think things will change, I think, for doctors in the first place, rather than for patients. That's my feeling. I have no science whatsoever behind this affirmation, but I think this is going to be the case. I think we tend to think that doctors have a hard time with technology. I don't think that is the case. Doctors have been using technology ever since the advent of technology. And AI is just another technology, a very impressive and important one, but it's technology nonetheless. So I think what is going to change in the next 5 years, for certain, is the experience of the doctors, the way they handle their operations and the way they handle their treatments. Once that is mature, probably the next step will be to really change the experience of customers or patients, which nowadays, as I was saying before, is like very old-fashioned. Actually, the way the system works is very similar to how it was working in the 1915. You get an appointment, you see a doctor, go back home, get the treatment, and blah, blah, blah. I think that is about to be changed, but probably in 10 years. In 5 years, doctors are going to perform differently. Yeah.
Super, super. That's very interesting. Also, I mean, it's hard to change, right? I mean, doctors, they are super prepared. They care about the patients, and they are used to study a lot, which not happen in every job, right, that you have. And in that sense, probably they are more open-minded to change, right? But that's a good topic for Eduardo, right? Because I can imagine how hard it has to be to sell software to a hospital that already works, no? That they have lots of doctors with opinions, the directors of the hospital, plus some of them are public, so they don't, I mean, they don't, I mean, it doesn't go to their pocket, right, if they do it better. Others are private, so how to change that? What is happening so that people is open to change, to improve, to evolve, right?
I think that, building on what you said, we typically, when you think about go-to-market motion in the healthcare space, we see doctors as barriers. But they're not. Or at least they are a right barrier. So they're protecting their patients most of the time. They are separating what's good and what's not. And they see a lot of technology every day, from pharma companies, tech companies, med tech companies. And so for you to be able to sell to a hospital, you need to tick all the boxes. It's the idea that agile and a minimum viable product is feasible in the healthcare space is a lie. And I think that many VCs push this towards their startup companies in their portfolios wrongly, because it simply doesn't work. And it will kill you ahead if you do that. And so you need really to tick all the boxes. And that speaks, for example, for the AI component. I think what we're seeing in AI right now, in this go-to-market motion that many companies are taking, they're essentially building operational improvements, incremental improvements to the healthcare productivity experience. So they're not actually changing the model, right? So we can do a report faster, that would be good, but that's not actually changing the model. If you have a model that has knowledge on it, why are you still going to that appointment? That appointment could be fragmented in multiple touch points over time, and all that knowledge could be fed into patients autonomously. But the thing is that AI right now is unregulated, and we cannot use unregulated software in hospitals. And I think that we are at this tipping point where AI is moving from the operational space into the clinical space. And some models have already been validated, of course, when I'm talking about next generation models. And once we see those models really acting in day-to-day clinical life, we'll see a complete change of the physician's role, empowered physician role that will exchange completely your experience and make it more yours. We have a very low self-efficacy from patients. So patients typically need to resort to hospitals and physicians for the tiniest thing. And AI is going to change that forever. So some of those tasks, low-value tasks of physicians, are going to be shifted to patients. And that's going to happen really rapidly. But in terms of go-to-market, I think that the best advice for fellow founders that may be in the audience is actually to tick all the boxes. You need to be a medical device, you need to be interoperable with the electronic health record systems, you need to have value, both clinically and productivity-wise. So all of this needs to be assured before you start your go-to-market motion.
Maybe I could add something about the willingness of the physicians, of the doctors, to maybe adopt technology. If we put ourselves in the shoes of the physician, we see that the system is stressed. I mean, there is a lot of pressure in getting health services. We also, as citizens, are asking for higher quality in that service, and at the same time, science is advancing at an accelerated rate. It's exponential. The discoveries that we have in medicine, in health. So taking that into account, and taking into account also that there is a shortage of physicians, what does the physician think when we propose a new technology to maybe make easier what they do? Maybe make a diagnostic easier, or maybe do a better treatment, or maybe follow up better the condition of a patient. Well, they're very, very open to that. They are not like maybe in other industries, they're not fearful that the AI is going to be taking their jobs. No, they're not. What maybe they're fearful is that they're not jumping into these technologies at a faster rate. And maybe the reason that that is happening is because of the funding. Well, we have the system that we have with their pros and cons, and maybe we're not so fast as the physicians proper would like to.
Yeah, I think the funding part is important for all this change. I think also that the way people are getting paid by doing their job doesn't encourage too much of a change, basically, because many doctors, we were discussing this before the session, are being paid by the hour. So that's not exactly encouraging transformation. So I think part of the discussion, because we are talking about technology here, right? But I think a very big part of the discussion lies within the business model, retribution model, those kind of things which are very instrumental in order to make things happen. Yeah. I think the system as it is ineffective. It needs to be more effective. But in order to create that effectiveness, I don't know if that's a word that exists, you need to really think about on how do you want to pay your doctors and what do you exactly want them to do. Because for dozens of years, we've been paying doctors for seeing people entering the rooms. That's not what we want. We want to get people cured, to get people healthy, to whatever, but not people entering a specific room in a specific moment in time. Yeah. So I think there is a very big collective thinking to be done around this.
And that's going to be super hard to change, right?
Yeah,
because I mean, it has implications on law,
probably
on labor contracts, on the...
is the simplest piece of work that we have to do here. Everything else is
much more complicated. Yeah. No, and that opens the next question, that is digital therapeutics, right? When the AI came, we read lots of articles about, I mean, in most of the countries of the world, doctors are far away and they are super expensive and people cannot allow to pay them, right? So one of the big benefits of AI is that you tell them your symptoms and they can suggest or help in the process of being treated. It's very controversial because it not always arrives to the right conclusions, but at the same time, it's something that, as you said, could save lives, and even for the doctors, could be like a first step before they analyze something, right? What are your thoughts on there? I mean, this is open to whoever wants to answer, but thoughts, will we see that when we think it's going to happen, or any ideas around that?
I can start. Yeah, go ahead.
Well, I was just going to say one thing. I think in this digital therapeutics area, at least in our case, what we are doing, start slow, but keep walking. I think that's so we are doing like little things, which I think are being impactful enough for customers. We are learning how to do things and to be careful, and eventually bigger things will come. But for the time being, to be honest, we are being cautious with this because digital therapeutics in itself is a very strong term. So it's a bit frightening.
We have 1 minute.
I think we have to think about this more broadly. I think that each new technology we add to the hospital must prove clinical outcomes. Otherwise, it's just a waste of time for everybody. That's why doctors sometimes block some of these things, because they don't see the value for patients. And so I think that, for example, symptom checkers are a missed opportunity. You use the symptom checker, in the end, it asks you to book an appointment at the hospital. So the time you were answering questions, you could have been driving to the hospital. So this adds no value to the system. So we need to really think, in a way, how is AI moving outcomes and improving outcomes for patients? That is critical.
Super, very, very helpful. So thank you very much for sharing your thoughts. Thank you very much for being here. And just applause.